and welcome. We're at Restorative Healthcare. My name is Tamie Yost, and I'm here with Dr. Heather Wisniewski. Hello, Heather.
Hey, Tamie, how are you today on this actually summer equinox?
Oh, yeah, we just did have the equinox, didn't we?
Yes, we did. This is the first day of summer.
Wow. Well, I know that we've talked about earlier in the spring, we talked about that different organs have different emotions tied to them, and different organs are also tied to different seasons.
Correct.
What's going on with the beginning of summer here?
In the beginning of summer, we are going into the season of fire in Chinese medicine.
Okay.
And fire includes the heart, the pericardium of the heart, the small intestine, and something called the triple warmer or triple heater, which is a lot of our endocrine system, our thyroid, our adrenals, our ovaries, our testes, our uterus, our prostate, and pituitary.
Okay, and each one of those organs probably has some emotions tied to it, right?
All of them have emotions tied to them, and each one has a little bit of a different emotion, but the general category of those emotions for all of those organs are the same.
Okay, so the fire is for all of them.
Yes.
But it's a different type of fire for each.
Correct.
Well, what about the heart?
The heart has a lot to do with being frightfully overjoyed, which is meaning that you have some fear, but you're excited about something, but your fear is overcoming your excitement. It can have a lot to do with love, deep, profound, unrequited love. It can have a lot to do with being very rapid, hyper-talkative, hyper-verbal, maybe even a little inappropriate giggling.
So a lot of the things that we already associate with the heart.
Correct.
Okay. Oh, what about the small intestines? Does that have things that we usually think about anyhow with emotions?
Oh, yes. Small intestine is easy. That's when we feel lost, helpless. We'll feel very vulnerable, easy to hurt, insecurity.
So all those internal gut feelings are actually internal gut feelings?
Yes. Feeling alone, helpless.
Oh, okay. Well, what about the adrenals?
The adrenals and the thyroids kind of get coupled in Chinese medicine, and those have a lot with our confusion, our muddled instability, finding a little bit of hesitation in making a decision or not understanding what is going on, feeling very lost in a conversation. You can even have a little paranoia with that.
Huh?
Yep.
What about the reproductive organs?
Reproductive organs, that's a lot of very commonly the feelings of not wanting to feel, kind of checking out, feeling very empty, very fatigued, very depleted. And a big one called non-thinking, non-emotive, which kind of makes sense because whenever we look and see or work with someone who has had sexual abuse, their emotions on it aren't there. They kind of checked out because who wants to remember that kind of very frightening event?
Right. And what would we do with the knowledge of these different emotions?
Well, one of the ways I utilize those aspects here is in regards to working with NeuroEmotional Technique, or NET, as well as I also use it when I'm actually doing the biomeridian. So sometimes if things come up that are very much patterned on the biomeridian, yet other things seem imbalanced that don't make sense, I'll ask people, hey, do you have anything like feelings of vulnerability right now? And a lot of times the person will say yes, and it can actually help me identify whether or not we need to use NET or go along with another approach to helping that person.
So the emotions are actually medically important.
Absolutely. It goes back to that mind-body connection we talked about. And one of the best resources, if you want to do a little extra side reading after this, is reading the Mind-Body Connection with Candace Pert, by Dr. Candace Pert. It's an excellent book that talks about really the cytokines and interleukins and that connection between our organs, our emotions, and our health.
Okay, well, if anybody out there, this has struck a chord for you and you'd like to have some of those feelings checked out, please give us a call here at Restorative Healthcare and we'll find a time for you to come in and have an appointment with Dr. Heather. And definitely, these are valid feelings, these are valid emotions, these are medical.
Absolutely.
Bring them up. Thanks.